Yeah, so I think the pandemic really pushed us to develop these kind of telemedicine skills. I think I'll speak for myself, not for you all, but I was a little bit hesitant. I didn't think it would be as effective. I think, to your point, having our hands on patients, being able to guide kind of movements was how we were going to get best outcomes. But we've seen, in our research that we're able to capture these really robust assessments in the home environment. We can actually see patients where they are. We don't have to make them come to us all the time. I think there's also opportunities to kind of merge assessments as well and use both our skill set as well as other tools that are becoming available as technology continues to grow and expand. But I think it will continue to take our expertise to make sure it's meaningful, robustly constructed, and actually is measuring what we think it's measuring.
I think the pivot to the remote and telemedicine during COVID was difficult for our patients and their families, but also the contact, having video contact while families were shielding for months on end was really important for everybody that they could see clinicians and have those conversations. It gave us a new opportunity to see the home environment. We're not often in doing home visits, so to be able to see patients at home and have those conversations about what things they did have at home. Does the sofa need some blocks under it because they're struggling now to get out of the sofa? We worked really hard on trying to standardise assessments in the home. Some assessments just don't translate. And that's also, we have to be mindful that if we are assessing in the home, there's a burden then on the parents or the caregivers as well to do that assessment with us live that isn't in the clinical practice. So there's a lot of things to consider. There's pros and cons for all of it. I think telemedicine should be more routinely utilised, especially for families that might struggle to come into clinic regularly or travelling from a distance, or the level of disability makes getting in the car and travelling for a few hours really, really difficult.
Mm-hmm. I think the goal of a lot of our assessments is to expand access to more people, so to expand the recruitment pool because we work in rare diseases, but also trying to give everyone a chance to participate. It was interesting, though, some people really liked the remote assessments and some people really missed coming in. And so I think it's just another way to offer a choice. You can't make someone adapt to remote access, but you give them the option, and you also give them the option to come in and see you.